Okay, so moving on with the second portion of their antibiotic presentation, let's talk about penicillin. First introduced in the 1940s, you can see way after our penicillin, and this was the first one that we had now bactericidal, meaning it's stronger. It's going to kill the bacteria quicker than our sulfas, which are bacteriostatic. As you can see, it kills a wide variety of gram-positive and some gram-negative, but penicillins are most notably known for killing gram-positive. They're also called B-lactams. And unfortunately, we have bacteria that produce enzymes capable of destroying penicillins. They're known as the B-lactamases, and there they are. They're special enzymes because penicillin's been around so long and we've gotten so resistant to it that the bacteria got smart, and they're producing these B-lactamases, which are enzymes that inactivate the penicillin molecules. And as a result, once it inactivates that metabolite made from our penicillin structure, the medication is not effective. So let's talk about our penicillins. The natural penicillins, they're very old. What they all came from are known as penicillin G, as in George, and penicillin V, as in Victor, potassium. Penicillinase resistant drugs, meaning they're going to keep those enzymes produced by that bacteria, the B-lactamases, so they're A's resistant, are cloxacillins, dicloxacillin, nafcillin, oxacillin. If you notice as I'm talking, and you can see it, penicillins almost always end in ILLIN, just like the term penicillin. So it makes it a little bit easier for you to know, so that you don't memorize yourself into the grave. You need to start associating most things that in an ILLIN are from the penicillin family. Therefore, they're bactericidal, and they've been around for a long time. Not only bactericidal, that they've been around since the 1940s, but they're that they'll kill mainly gram-positive bacteria. We've got our amino penicillins, which are amoxicillins, ampicillins. I know a lot of you have heard a lot about a lot of these drugs because they've been around for a long time. Extended spectrum penicillins, meaning they're going to kill a lot more than just our penicillin Gs, are piperacillin, ticaracillin, or carbenicillin. Chemicals that have been developed to inhibit the enzymes. Going back to what I was talking about here, where we've got the bacteria producing enzymes, the B-lactamases, that inactivate the penicillin molecules. We have chemicals that have been developed to inhibit these enzymes, and these chemicals are clavulanic acid, tazobactam, and sulbactam. So these chemicals bind with the B-lactamases, or those enzymes that are going to inactivate the penicillin, and it prevents the enzyme from breaking down the penicillin, making it effective. So how do we use them? Here, let's look at it. One of them was sulbactam. So we put ampicillin and sulbactam together, and we have a new drug called Unicin. So it's a penicillin B lactamase inhibitor drug combinations. Amoxicillin and our clavulanic acid gives us augmentin. Augmentin is extremely strong drug, very, very broad spectrum, that can kill kills so many organisms that a lot of times when you give it to females, it wipes out all the normal flora in the vaginal area, and they end up with a yeast infection. Ticaracillin and clavulanic acid, we get timentin, and then piperacillin and tazobactam, we have zosyn. Penicillin mechanism of action. Let's look at how does penicillin work? How is it actually cytal in nature? It enters through the bacterial, right through the cell wall. Inside the cell, it binds to the penicillin binding protein. We have normal cell wall synthesis is disrupted, and the bacteria dies from cell lysis. So it basically kills the entire cell entering through the cell wall. Penicillin does not kill other cells in the body. So it's a fairly, fairly good drug in that it goes to where it needs to go, and then kills the bacteria. Prevention and treatment of infections caused by susceptible bacteria. Again, gram-positive bacteria, strep. You got a strep throat, strep infection. Penicillin's the one to take. enterococcus and staph infections. There are people that are allergic to it. I actually was surprised it was so low. I thought it would be much higher, but 4% is high. So 0.7% to 4% of all cases. Urticaria means rash. Pruritus is itching. Angioedema can be swelling or hives. Those allergic to penicillin have a 4 to 6-fold increased risk of allergy to other B-lactam antibiotics because they're all taken from that penicillin chemical chain. Any patient taking penicillin should be carefully monitored for an allergic reaction for at least 30 minutes after its administration. Effectiveness of oral penicillins is decreased when taken with caffeine, any citrus fruit, soda beverages, specifically colas, fruit juices or tomato juice, administer with at least 6 ounces of water. So again, sulfa, we need 2,000 cc's of water a day, whereas with penicillin, not quite as much. Just good rule of thumb is to push the fluids and push water on any oral antibiotics. Okay, let's talk about cephalosporins. It's our next group. And they're semi-synthetic derivative from a fungus. Remember, we talked that most of our drugs, drugs, period, come from plants and animals. Structurally and pharmacologically related to penicillins, and they're bactericidal, just like penicillin. Broad spectrum, though, more broad spectrum than penicillin. First generation are cefazolin, cefadroxil, and cefridine. These are all generic names. Good gram-positive coverage and poor gram-negative. So, again, it mimics penicillins. Oral and parenteral routes. Remember, PO means oral. First generation used for surgical prophylaxis or, prevent an infection and middle ear infections. Cefazolin, old drugs. Trade names are Ancef or Kefzal. IV or IM, intravenous or in the muscle. Cefaxilin is Keflex or oral, PO. Second generation have good gram-positive coverage, better gram-negative than first generation, meaning they came later. Cefaclor, cefoxitin, we see a lot in the hospital. Cefmatazole, again, surgical prophylaxis, abdominal or colorectal areas. Third generation, most potent group against gram-negative bacteria and not as effective against gram-positive. So they came the last, but now they finally found a group of cephalosporins that can kill the negative, gram-negative bacteria. Ceftazidime is the one we see most common. Easily passes through the cerebral spinal fluid to treat central nervous system infections. So that would be the brain and spinal cord. So very, very good drug for that. And then finally, fourth generation of cephalosporins, a broader spectrum against gram-positive, and it's the newest cephalosporin. It's called cefepime or maxipime. Orally administered forms should be given with food to decrease GI upset, even though this will delay absorption. Some of these drugs may cause a antabuse-like reaction. Antabuse is the drug they give when you're taking a lot of alcohol. They will make you very, very sick. The whole idea is they don't want the people to drink. And some of these drugs can cause that type of reaction. And the reason I put that in there is that's why we want to give it with food. Poor absorption, but who cares if they're not vomiting? If they're vomiting, they're not getting it anyway unless we're giving it IV. Okay, let's move on to the next group of drugs. It's called carbapenems. Very broad spectrum antibacterial drug. They have clavulanic acid in the chemical composition, so it is considered B-lactamase, just like all of those ones that we put with the penicillins. And these ones are a very special drug. We don't see them all the time. They're reserved for complicated body cavity and connective tissue infections. May cause drug-induced seizure activity. So again, when you've got a drug that does that, we're only going to use them when we have to. All given parenterally, which means IV. Premaxin would be the trade name, used for treatment of skin, bone, joint, and soft tissue infections. Okay, let's see. This is often used as a last-line agent. They're the antibiotics considered of last resort, although we're now seeing resistance to this class of drugs also in recent literature. So this one is even broader spectrum than penicillins and cephalosporins. It covers broad spectrum. Remember, it's not narrow. It it can kill a lot of different drugs. And then we've got our macrolides, which are our erythromycin, also known as emycin or EES, azithromycin or zithromax, clarithromycin, bioxin. The macrolides are more bacteriostatic, so they're like the sulfonamides that way. High enough concentrations, they will become bactericidal. Indications, again, strep infections. If people are allergic to penicillin, they may give them a macrolide. Usually we give erythromycin if they're allergic to penicillin because it will kill strep. Mild to moderate respiratory infections such as Haemophilus influenza, spirochetal infection, syphilis and Lyme disease, gonorrhea, chlamydia, mycoplasma. Mycoplasma is atypical pneumonia, or it also referred to a mycoplasma means walking pneumonia. Adverse effects, primarily erythromycin. It's another one, nausea, vomiting, diarrhea. You notice kind of a trend with all the antibiotics. We need to give it with food. Yes, metabolism will be a little bit slower, but so what? They're keeping it down. And it can also cause hepatotoxicity. Okay, our tetracyclines. Bacteriostatic, a very broad spectrum. These should not be used in children under 8 or if women are pregnant or lactating, because tooth discoloration can occur if the drug binds to the calcium on the teeth. And they literally will turn their teeth black. So we have to be cognizant of that. Again, it's tetracyclines are more of the milder drugs anyway. They're more bacteriostatic, broad spectrum. Adverse effects, they have strong affinity for calcium, and that's why they discolor permanent teeth in the fetus and in children. May retard fetal skeleton development if taken during pregnancy. With all these drugs, let's go back and look at that. Wide spectrum for tetracycline, because again, at the top, we've got broad spectrum. Protozoa, rickettsia, it's a group of small bacteria that can cause typhus. It can be potentially fatal, and the illness is transmitted by a mite or a tick. Mycoplasma, again, is walking pneumonia, chlamydia, STD. Rocky Mountain spotted fever is another one caused by a tick. Syphilis, Lyme disease presents with a rash, headache, fever. They have neurological problems, can have cardiac problems, arthritis. It's caused by another bacteria transmitted by a tick. So a lot of these, thank goodness we have tetracycline for our ticks because of what happens there. And then this one I will end in with the tetracycline. If you look, most of them end in cycline, CYCLINE, and that would be our tetracyclines. Doxycycline is also Dorix and Vibramycin. So nursing implications for tetracyclines. Milk products, iron preparations, antacids, and other dairy products should be avoided because of the chelation and drug binding that occurs. All medication should be taken, you're hearing this over and over, 6 to 8 ounces of fluid, preferably water. And due to photosensitivity, avoid sunlight and tanning beds. Very, very important. Okay, we will end with this section of the antibiotics and move on to our last section.